guys, today I have with us our resident physical therapist, Dr. Alison, and so she is going to talk to us about proper squat techniques. One thing that I hear quite often is I want to be able to squat, but I don't know how to do it effectively because it hurts my knees, it hurts my back, or it hurts somewhere else in my body. And so I brought Alison in because she's an absolute expert in this, so she's going to use me as the patient, which is kind of exciting. And she's going to show you the proper way to squat and what you want to make sure you're looking for. So Alison, take it away.
All right, and as Kelsey said, when people have injuries or they have pains during squats, then they kind of stop doing them. And so what I would like to help you with is to prevent injuries and then also help with lower leg strengthening and core strengthening while you're doing an exercise. It's important for at the gym and when you're doing tasks at home or at work, such as bending and lifting. So the things to remember when you are doing your squat is the first is setup. And so having your feet about shoulder width apart and your feet slightly angled out. There's different schools of thought on that. I believe that everyone's a little bit different in how they're set up in their hips. So when you are doing your squat, if you get a pinchy pain in the front of your hips, just try to widen your hips, your foot stance a little bit more, just like that, and angle them out a little bit more, and then try it again. And if that feels better, then go with that width. It's not cookie cutter. So kind of play around with foot positioning. And then the next step is to, you'll have the weight in your heels. And so when you sit back, you're going to sit back in an invisible chair. This time I brought a chair just so you'd visualize how she's getting down to that 90-degree angle. Her knees are behind her toes, and she's sitting down at that 90 degrees. And then when she powers up, she's using her legs, not her back. And what can really help with that is using your TA, so that's a transverse abdominis. It's our deepest core muscle. If you're unaware how to activate that muscle, I have another video about TA setting, and so you can look at that. But when you're doing your squat, you should also be using that to support your spine, and so that's what she's using as her core to lower, and then her legs as well, reaching back, keeping that back nice and flat, and then coming back up. And where you have your head positioned, you can gaze down at the ground. You don't need to be erect like this, because then it puts a lot of extra strain on your neck when it's a leg workout. You should be having it more of a leg workout, not a neck one. So we'll do one more squat. Good. Excellent. Once you perfected the form, just like Kelsey did, you can progress by using weights. And then also going to, if you want to use the Smith machine, that's a good progression after using dumbbells, and then onto barbells or kettlebells. I'm not going to go into that for this video, but stay tuned for the future.
Bye, guys.
Bye.